My name is Vikas Arora, and I'm a Consumer Safety Officer with the Drug Registration and Listing Branch within the Office of Compliance. And today I'm going to be talking about complying with Labeler Code request requirements. Here are the learning objectives for this presentation. It is to provide a list of required data when a Labeler Code is requested from the FDA, identify some common Labeler Code related issues that we come across, and explain in what situations a Labeler Code may get inactivated immediately. So let's get started. What is a Labeler Code? Labeler Code is of course the first segment of the NDC code. It is a numeric 4 or 5 characters. Under 21 CFR 207.33b, the length will increase to 6 digits once we run out of 5-digit Labeler Codes. And as my colleague mentioned in a previous presentation, this is assigned by FDA. So Labeler Code requirements were passed in Section 510 of the Food, Drug, and Cosmetic Act and codified under 21 CFR 207.33c, which states the required information needed for a Labeler Code for the Labeler Code request, as well as the update requirements. In what time frame does this required information need to be updated when there is a change? So who will be assigned a Labeler Code? You saw in the previous presentations how to submit a Labeler Code request to the FDA, and I'll repeat here that each person who engages in manufacturing, repackaging, relabeling, or private label distribution of a drug product subject to drug listing requirements must apply for an NDC Labeler Code because they must list, or the drug distributed under their name and label must be listed with the FDA. It is imperative that the correct and complete information is submitted at the time of request so the FDA can make a proper determination for assignment. Only complete information that is submitted for a manufacturer or a private label distributor of a drug will result in the assignment of a Labeler Code. So what information is required for a Labeler Code request? This is stated again under 207.33 C1 and includes a name, physical address, and email address of the person for whom the NDC Labeler Code is requested. It includes a type of activities or business operations that the Labeler Code is engaged in, and the type of drug to which the NDC Labeler Code will be applied. So how do we assess our Labeler Code data? Well, our compliance program was started back in 2015 and ensures data integrity and focuses on the requirements of 510 of the Food, Drug, and Cosmetic Act and 21 CFR 207. If there are any issues with the Labeler Code data, we will issue a deficiency letter. And if the deficiency letter is not responded to in a timely fashion, we can proceed with additional action such as inactivation of the Labeler Code. So what are things that we assess as a part of Labeler Code compliance? We check to see that the labeler data is submitted accurately and completely. We check to see that any updates to the required information are submitted within 30 calendar days after any change. And we check to make sure that the Labeler Codes are assigned by FDA. So what are common Labeler Code issues that we come across? We come across contact information that is outdated. We often see that when a company goes out of business, they delist their drugs, but they do not inactivate their Labeler Code. And we see that the Labeler Code name is not updated in all the drug listing SPLs after it has been updated in the Labeler Code SPL. Please note that updating the Labeler Code information in the Labeler Code request SPL does not automatically populate the change to all of the listing SPLs under that Labeler Code. This can be complicated because the drug labeling still refers to the old name. If the labeling does not include the old name, all listing SPLs should be updated if the labeler name changes to reflect the new one. If the drug labeling includes the old name, the labeler name in the drug listing should be updated as soon as new labeling with the new labeler name is printed and included in the drug listing SPL. So when is your Labeler Code submission not in compliance? If the business operations are not complete or accurately described, if the type of drug is not provided correctly, for example, if the drug is prescription but you present it as an OTC drug, and if the proper updates to the required information are not submitted within 30 days of change. For example, updates to the business operation and updates to the labeler code contact information. So what do you do if you have received a deficiency letter? Provide all the required updates within 30 days of receipt of the letter. If no response is received on our end, the assigned labeler code may get inactivated. And an inactivated labeler code cannot be used for drug listing submissions going forward. So what are some situations where a labeler code is instantly inactivated? For one, if we come across a labeler code that was never assigned by FDA, we will inactivate that labeler code immediately. Similarly, if a labeler code was assigned by FDA but based on false information that was presented to us, that labeler code will also be inactivated. And lastly, once a notification about inactivation is provided to the labeler point of contact given, we will proceed with the instant inactivation of the labeler code. So now let's go over some challenge questions. Challenge question number 1. A labeler code request SPL is only submitted once when you're requesting a new labeler code. A, true, B, false. And the answer is false. Although the first time the SPL is created and submitted is typically when you request a labeler code, there are other reasons to submit a labeler code request SPL. For example, if you had an old labeler code submitted via paper forms prior to 2009, and now you start manufacturing drugs again and need to register your labeler code electronically. Additionally, each labeler code SPL must go through reviews and revisions must be made if any changes are required from previously submitted data. Although not required as a best practice, we recommend reviewing your labeler code request SPLs at least annually during the registration renewal and the drug listing certification period. Challenge question number 2. Which data is required for labeler code request submissions to FDA? A, labeler email address. B, labeler business operation. C, manufacturing establishment. Or D, only A and B. And the answer is D. Labeler email address and labeler business operations are two of the requirements for labeler code request submissions. And lastly, challenge question number 3. Currently, how many digits is a labeler code? A, 5, B, 4 or 5, C, 4, 5 or 6, or D, none of the above. The answer is B, 4 or 5. Currently, we have 4 or 5 digit labeler codes. Once we run out of these labeler codes, we will move to 6-digit labeler codes. In summary, please submit accurate and complete information to FDA when you request a labeler code and follow all update requirements to avoid a compliance case and further actions such as inactivation of your labeler code. Thank you for listening to this presentation, and we look forward to your questions in the Q&A session.